Welcome to Overdose Prevention and Outreach with LGBTQ plus communities. My name is Merlene Tucker, and I'll be running this Dialogue for Health web forum alongside my colleague Jeff Bornstein. Thank you to our partner for today's event, the National Overdose Prevention Network, a program of the PHI Center for Health Leadership and Impact. Dr. Mary Maddox Gonzalez. Dr. Gonzalez is a coach and preparedness consultant for the California Overdose Prevention Network, a program of the PHI Center for Health Leadership and Impact. She served as the Sonoma County Public Health Officer and Division Director, and the Chief Medical Officer of the Redwood Community Health Coalition for Sonoma, Napa, Yolo, and Marin counties. She has been a board member and chair of the Latino Coalition for a Healthy California. Welcome, Mary.
Thank you so much. And it's my pleasure to welcome you all to today's webinar. Could I have the next slide, please? Today we'll be starting off with some poll questions to get a sense of who's on the call and your current background and knowledge regarding how to best outreach with LGBTQ communities and agencies. Also, we're going to be talking about with two speakers about different aspects of current efforts underway, and then we're leaving plenty of time for questions and answers for you. So you will be learning about overdose prevention, harm reduction, and outreach with LGBTQ populations. And this webinar will help you identify ways that you can incorporate LGBTQ populations in your work, and some ideas for partnering with LGBTQ plus organizations in your communities. Next slide, please. Okay, well, we're going to get into the portion of our program. We're going to have two very experienced individuals with firsthand experience talk about overdose prevention and outreach with LGBTQ plus communities. Next slide, please. Our first speaker will be Santino Lojero. She's also known as Bibi. And Bibi has been involved in community work many years in various capacities, starting as a high school student when she herself was in need of LGBTQIA plus resources. She's been performing over the years and producing queer and trans-focused events in the queer nightlife scene throughout Southern California. And currently she works as a resource navigator with the Latino Equality Alliance to expand queer competent resource navigation in Southeast Los Angeles. She really leverages her extensive experience with LGBTQ plus navigation advocacy with her unique position with the LA queer nightlife scene. And really this has advanced her efforts in connecting community members to necessary resources that keep one another safe. Welcome, Bibi.
Hi, oh my gosh, thank you all for having me, and thank you, Mary, for introducing me. So we could go to the next slide, please. So my name is Bibi Lojero. So I go by Santino Lojero, but also, so my performer name is Bibi Discoteca. So a lot of people know me as Bibi, and in nightlife and in community as Bibi. So that's why I also go by Bibi. My pronouns are she, her, and I work for Latino Equality Alliance here in Los Angeles, California. And today I'm here to talk to y'all about Cutie Connect, which is Latino Equality Alliance's substance use education and harm reduction program. So I'm excited to, share a little bit about our work and the work that we've been doing over the past few years. And I hope that y'all are able to connect to something that I say today. We could go to the next slide. So I just want to start off with just talking a little bit about Latino Equality Alliance as an organization and our mission a little bit. We've been around for, this is our 15th year of being an organization. So that's really major. We actually just had our gala last week as well. But I just want to read y'all our mission statement. So Latino Equality Alliance, also known as LEA's mission statement is to advocate for the safety, equity, and wellness of the Latinx LGBTQ plus community. Our focus is to build power through leadership, development, and academic success with LGBTQ plus youth and families. So this is something that we really take pride in and highlight is that we're able to work with a lot of young queer students that are trying to, get their footing in the world, find their place in the world, and give them the tools for that type of leadership and that type of success. And with that, with those tools, part of that formula to working with youth is also being able to work with their parents that may have a lot of questions about their child's newfound identity or coming into themselves more. So that's something that we've been able to do throughout the past years. We do a lot of fun events. We do a lot of programming for parents of LGBTQ youth and students. And we do a lot of partnerships with different organizations that do kind of the same work, but we fill in the gaps for each other where if we don't have something, we know someone that does have something. So let's go into the next slide and talk a little bit more about QT Connect, specifically the program. So like I said, QT Connect is a substance use and harm reduction education program. This is a program that was kind of different from the ones in the area because a lot of, at least in my experience, coming from someone that was in HIV and AIDS care and that sort of the nonprofit work, a lot of programming, it tends to be focused on gay men, gay cisgender men. So this program was a program that was kind of changing the focus on that and trying to focus more on queer and trans people and femme-identified people as well, because oftentimes these are the people that don't have as much access to resources as their cis gay counterparts. So we want to make sure that this is something that's highlighted. And another part of this program that we want to highlight as well is that we're focusing on Boyle Heights and Southeast LA specifically, because in Los Angeles, there are so many resources. Not to say that everyone knows about those resources, that's another thing, but there are a lot of resources in LA proper, in the metropolitan area. But when you go into the outskirts and the rim of Los Angeles, such as Southeast LA, there aren't as many accessible LGBTQ plus resources for people to access. And then also then you run into the issue of like, do people know these exist? So that's where QT Connect and me come in, so that way we're able to connect people where they need to go. So some of the things that we did through this program are monthly events and workshops. We did recognizing signs of overdose workshops, substance use and harm reduction education workshops, where we just go over different types of substances like opioids. We go over what harm reduction is, our approach to it, because that's really revolutionary for a lot of youth and even people, it's revolutionary for a lot of people in general, because if we, trek back in our minds back to our days in school and high school, elementary school, whatever it was, a lot of us think of Red Ribbon Week and like just say no to drugs, dare to just say no to drugs. And that's an approach that we have seen obviously does not entirely work. In fact, it just instills a lot of fear in people, and people end up doing things based out of fear rather than based off of information. So that's something that we really want to push in this program, to make sure that people knew about this approach that we're taking is through harm reduction. We're not trying to shame anyone. We're just trying to get people the information that they need to be safer and keep one another safer. So we had each workshop that we had, we always paired it with some sort of like fun activity or fun event. Like the first workshop that we did, the first event that we did was a queer dodgeball game. And a lot of the feedback too from the events that we've done is that it's nice to be around other queer people and not inebriated, for lack of a better words. So that's some of the feedback that we got that was really meaningful to me, because a lot of times, and this comes from me as a nightlife producer, a lot of times I am producing these events that are like dance raves and like drag shows and things like that. And they tend to be, with the, this is at a bar, so there is going to be alcohol. So it was nice to, produce events like these where people are able to, have a sober option to connecting with other queer people. So we did a queer dodgeball game. The next one we did was a mural reveal event with another organization called Sella Art Center in Bell. And also a big one that we did was the queer clothing exchange and wellness wear, where we were able to get a lot of corporate sponsors to donate to these gift bags that we were able to give out to community. And we had a queer clothing exchange going on. But on the side of that, we had 3 different workshops. One was like Activism 101. Another one was self-defense, especially self-defense through the lens of being trans and queer and trans. because the instructor kind of really talked us through the issues that we face more specifically, and tying that back into self-defense. And we also had the recognizing signs of overdose a presentation at that event as well. So we did a lot of cool things is all I'm trying to say. And aside from those cool things, we also had a monthly harm reduction support group where I include this little picture in the corner where it says like, what's in my bag tonight? And that's kind of like a reflection tool that we use at our harm reduction support groups. And it basically just takes you through like, okay, these are the things that I like to do when I go out. Now that I know the things that I like to do when I go out, what can I do to incorporate harm reduction and safety into those things that I already like to do? So it's just a really real reflection tool of like, you know, if someone says that they're into you know, doing ketamine at the rave or something, it's like, okay, so we know that you like to do this. Now, how do we make it safer and have a safety plan for you? And that's kind of a little overview of our program. Now I'm going to go into talking about kind of our outreach and approach to, you know, making this program successful. So can we go to the next slide, please? So in outreach in general, we always believe, you know, outreach where the people are at. And in our case, our queer and trans people were frequenting raves, clubs, other community centers, partner organizations, and high schools as well. There's a lot of queer youth in the Southeast LA region that, you know, are still under the discretion of their parents. You know, they may not be out, but that's why it was really important that we were able to build those relationships with high schools specifically in the Southeast LA region. I think we were at Huntington Park High School and Bell Gardens High School, and we were able to do some outreach there. So, you know, we were just outreaching where the people are at and trying to make sure that we have visibility around the things that we're trying to get accomplished. So we were always outreaching. I'm jumping around on the bullets here, but we're always outreaching for specific activation. You know, if we were outreaching like for schools, we were like, oh, well, you know, hey, we have a queer dodgeball game coming up, or we have this online workshop coming up. That's really easy. It's only 30 minutes, you know, and it's a little bit more low key, a little bit more discreet than coming out to an actual event if that's more of your groove. So we were always, you know, making sure that there was something to do and there was something for us to attract the people in. So that way they're able to do our workshop and then eventually, you know, maybe start frequenting our harm reduction support groups. Another big thing that you know, made this program successful is that we partnered with orgs doing similar work. I mentioned that we partnered with like an Overdose for one of our events, and that was amazing because you know, us as an organization, we were like new to this type of work in substance use specifically. So partnering with an Overdose that has been established in this and it has more infrastructure to give out fentanyl testing strips and Narcan at our events, that was really valuable. And it was really valuable to have us, you know, collaborate on the presentation of, you know, this is like how to recognize signs of overdose. And me and my team were able to, you know, kind of give more context of what that looks like in a nightlife setting, in a party setting, because it's not always the same thing. And sometimes, you know, people are worried about, you know, police, authorities, and things like that. So we kind of gave context on like what to do in those situations from the queer nightlife's perspective. Another big, huge part of this program was our ambassadors. And can we go back to the last slide, actually? So our ambassadors are here on the left. We worked with 5 different community ambassadors, and they really represented the Southeast LA region and downtown LA region as well. And they all had such a unique background that really made this program what it is, because we were able to collaborate on every single event that we did. And they gave input into what they wanted to see and what they felt the community needs to see out of an event. So like we had someone that was very well established in queer nightlife and producing raves, dance parties, and etc. And she had her foot in a lot of different scenes, whether it was like raves or like also like strip shows as well. So we had one ambassador that did that. We had 2 ambassadors that were very well known and respected in the LA drag community. And then we also had 2 people that were really active in the like LA underground music scene and doing like backyard shows at different places and things like that and small events. So that mixture together really helped make the program what it was, and it gave us that community, that connection to community, to be able to do all the events that we did and be able to build the trust that we were able to build. And then can we go to the next slide? And then the next slide. Okay, so I just wanted to end today with talking a little bit about our results from our program. So we measured our success by doing pre and post surveys for all of our workshops that we did. So this is the pre-survey. Data-wise, I think we got around like 70 participants to do like the pre and post, but there was a lot more than that attended, but trying to get people to do surveys sometimes, that's just one of the barriers that we run into. But so this is the pre-survey, and we have questions like, I know what resources to use for addiction or overdose. I know what naloxone, Narcan is. I know how to recognize signs of overdose. I know what are opioid drugs. And we see the data is a little bit more spread out. This is ranked from 1 to 5, 1 being the least, and then 5 being the most comfortable. So we see this data and it's kind of spread out. People are walking in, not really sure, maybe they've heard of these types of things, but then we go, so then we do the workshop and we're able to engage with these community members, engage with these participants. And then we ask them to do the post survey, and we could go to the next slide. And then we see there's a big increase of people knowing what's going on and knowing what to do in these tough situations. So that was like really affirming for all of us here at Latino Equality Alliance and everyone on my team. That was just like really cool to see that people were really absorbing this information. And I think it's in part because of the team that we had and the ambassadors that we had, and we were able to really connect with people where they were at and where they were thinking in a way that wasn't shamey or like engaging in any type of like already made stigma around drugs and drug use. We're just meeting people where they're at and giving them the tools that they need to keep one another safer. So I am very proud of that. And then we could go to the next slide. And that was just a little bit about the QD Connects program. I look forward to talking to y'all more in the Q&A at the end of this. If y'all have any questions, please let us know. But in the meantime, please follow us on Instagram, Latino Equality Alliance. We are at Somos Leia. And thank you so much. And I'm going to pass it back to y'all. Thank you.
Thank you so much, Bibi, for that great presentation. We really appreciate it. Our next speaker, and the next slide, thank you, is Brian Poth. Brian is the co-founder and executive director of the Source LGBT+ Center. He identifies as non-binary queer individual. He co-founded the Source LGBT+ Center and was its first board chair and executive director in 2017. So they just celebrated actually 6 years of serving the queer and trans community. They have over 30 programs and services, many of which you're going to learn about today. Brian was awarded the Community Leader of the Year by the ACT for Women and Girls. And under his leadership, he's done something that's really hard to do. He's gone from a grassroots organization with a $20,000 annual budget to the largest LGBTQ+ center between LA and Sacramento, very large geographic area for those of you from other parts of the country, and an annual budget of $2.7 million. Congratulations, Brian, and welcome.
Thank you so much. I'm really excited to be here today. Thank you, Bibi, for your wonderful presentation. And we can go to the next slide. So as was said before, I'm the co-founder executive director of the Source LGBT+ Center. My name is Brian Poth. I use he and they pronouns. We are a center that serves 3 counties. So we serve Tulare, Kings, and Fresno County, which is right in the center of rural California. And our project was the Rainbow Recovery Project, opioid use and stimulant use prevention and recovery services for the LGBTQ+ and Two-Spirit community. This was a project that was funded through the center at Sierra Health Foundation. And we ran the program for a year, and we're continuing the work as we speak. So next slide. So we started out, this is sort of the life cycle of the program. We had some strategizing, we had some support groups, we did outreach, and we ended with our Narcan distribution project. So Rainbow Recovery was an extension of our previous MAT work. We played with our strengths while including some new aspects. We developed new pamphlets in new languages and developed new support groups based on the feedback we got from previous groups. The new support groups focused instead of on recovery specifically. It talked about, spoke to social emotional wellness. So because we are where we are in California, we are about 20 to 30 years behind in terms of resources, access to care, LGBT affirming services. And there's no place here locally where you can really get LGBTQ affirming recovery services. There's one LGBTQ affirming recovery center, and it's in Fresno. So that is often too far for people to drive. And we host the only LGBTQ 12-step program at the Source LGBT Plus Center that's in 2 counties. But that's not always the best fit for people. So focusing on harm reduction, we looked at intimacy and recovery. We led a group on healthy boundaries, conflict resolution, wellness, and living with HIV. And we also supported the first source-based group in a different county, which was in Fresno. And we hosted a healing retreat, which was really probably the highlight of the program. What we found was that people really needed to disconnect, especially after COVID, from being in front of a computer, or being in a large group of people where they're sort of inside. So having a retreat that was outdoors and doing things outside over a couple day period was really helpful for people. We had over 40 participants during our 2-day retreat. We ran multiple campaigns, including billboards, Grindr ads, which is social media and dating apps. We had a podcast, and we produced 7 PSAs that ran on our social media. They're live on our website, and they were also live on our website, and they ran on social media. And then lastly, we finished with our Narcan distribution project. So originally we had set aside quite a bit of money in the funding to purchase Narcan kits. By the time the grant was released to us, DHCS we were able to sign up as a distribution site and get those kits for free. So now we are registered with them and can just order our kits through them, which was really helpful. Next slide. So in our area, you don't see a lot of queer or trans representation in media. There are the only billboards in our area that run any queer messaging are ours. So we really focused on getting the message out, and we were able to do over 3 million impressions on all of our media sources. During the campaign, which directed everyone to our resources page on our website, we were able to get 76,000 website views, and we directly outreached to 5,687 individuals. Next slide. So here's just an example of the Grindr ad campaigns that we use to reach people who are using the app. This was something that is done in many different areas, metropolitan areas, and has been done for years, getting people resources to where they are online. This is the first time that we know of this has ever been done in our area. So we're specifically outreaching to folks who are on the dating apps, trying to hook up, and also there is a subculture within the LGBT community that can be at higher risk for stimulant use disorder tied to sexual behavior. And now, because fentanyl is such overwhelmingly in almost every single street drug there is, there was information that we could do and use this dating app to get that information and resources out to folks around harm reduction and opioid overdose. Next slide. So our Grindr campaign, we had 265,000 impressions. And out of those 265,000 impressions, 36,000 people clicked. And those 36,000 people were redirected to our website. They were, if you go to the source lgbt.org/recovery, there are resources around LGBTQ affirming 12-step programs, our support groups that we were hosting at the center, our billboard campaigns, our PSAs were all on the page too. So it was really important that we were able to show people that recovery is possible, and that people who have used drugs, recovery looks different for people, and it's not always abstinence, it's not always 12-step, and it does look different for folks. So we were really focusing on telling those stories of recovery with our PSAs and our podcasts. Next slide. So this is just an example of some of the folks that we featured in our social media campaign and in our PSAs. So every single person you see here is at a different phase in their recovery. Mary, for instance, has been sober for over 37 years, got sober as a teenager, and has a very specific story of recovery that focuses on mental health. She shares in her video that after many years of being in recovery, she struggled with mental health. She struggled with suicidal thoughts, and she really sort of normalizes and destigmatizes mental health and the tie to stimulants and stimulant use. The other folks here are people who have lived experience with substance use. Some of them are now drug and alcohol counselors. Some of them are well-known queer staples in our community. So seeing them tell their stories of recovery is really helpful to our community. Next slide, please. So this was part of our social media campaign. We educated folks on what is harm reduction, what can recovery look like, some risk factors for folks. We talked about stimulant use disorder quite a bit because our area, there are so many folks are using crystal meth at an alarming rate, especially tied to sex and hooking up. And we wanted people to know that they weren't alone and that there's no shame in it, and that there are resources here that are led by LGBT folks who have lived experience with recovery. Next. So we have a podcast that our organization runs. It's called Queer Goggles, and it tells firsthand stories of folks who live in rural Central California. We've done this podcast we're on 5 seasons right now. The 4th season focused all on recovery. So each episode focused on specific stories from people who identify as LGBTQ in our community, how they recovered, what their experiences were, and the resources that they used specifically to get sober, stay sober, and live a healthy life. Next. And then last, our Narcan distribution project was debuted at the end of our, back in January, I think, and we partnered with over 10 other local organizations to get them kits so we could get kits to people. So all of the social media posts you see here directed people, linked them either through Instagram or through Facebook directly to our website. And if you needed to get Narcan, you could get it at the center, or you could get it at one of our distribution sites within our county. Next slide. So, so far, we've distributed over 384 naloxone kits. We became a distribution partner with DHCS. And like I said, we partnered with other community organizations that serve LGBTQ folks. We're everywhere. We're not just at the LGBT Center. So we partnered with Salt and Light, which is an organization that focuses on homeless outreach. We partnered with Touchstone Recovery Center, which is a recovery center partner that's LGBT affirming and culturally competent in Fresno, California. We partnered with the Arts Consortium that has a mental health outreach program that works with folks in the mental health care system who are doing art therapy, filmmaking, and photography. And we focused and we worked with organizations like Mending Fences and the Community Justice Alliance. Next. So we loved having support groups and wellness retreats that focused on different things. We didn't really, what we heard from was focusing on resiliency and health and social emotional wellness. And we were trying to target the sources of why people might turn to drug use, which is a lack of connection, a lack of community, isolation, loneliness, and things like that. And that can be really hard when you live in an isolated rural environment. So we did From Shame to Resilience group. We did a healing journey wellness retreat. We focused on people living with HIV, and an intimacy and recovery group that was focused on harm reduction while being sexually active. Next slide. And that's it. Thank you so much for listening. Looking forward to your questions, and thanks for inviting me.
Thank you, Brian, for that wonderful presentation. It's much appreciated. And I really appreciate all of the reactions that we're getting throughout the webinar. Keep them coming. Thank you. And just to remind you, if you have questions, please put them in the Q&A portion at the bottom of your screen. You can put those questions into there, and we will be happy to respond to them. I had a question to kind of get started. We know that overdose prevention is quite complex. What are some of the special considerations that you think members who are individuals who are on the call today, folks on the call from across the United States in many different environments, should include in their overdose prevention with regards to LGBTQ plus individuals and communities? I mean, Brian, you had mentioned one that particularly stimulants is an important area, but just overall, what do you think are additional areas that either of you would think were very important to include?
I think Bibi said it best when she said, you have to go to where the people are. And so we sort of did that with, we did do that with the dating app. So we know there's a direct link to drug use and sexual activity and high risk drug use. So we wanted to get on the dating apps. And because there's no messaging, and we can target certain populations, certain age groups, certain demographics, geolocate, it was a really good return on investment because you could see the amount of impressions we got, the amount of clickable, website views. We got a lot of bang for our buck in reaching the folks that live in our area because our area is not very big. So I would say for us, it was thinking outside of the box and moving more toward a harm reduction model and showing up to where people already are, which was, for us, it was online.
Thank you.
Yeah, thank you, Brian. And I think on our part, I feel like a lot of that came from, these are really heavy topics. These are really heavy subjects. So I think for us, what worked was kind of balancing that out with the programming that we did, where it's like, they're coming in for a dodgeball game, but obviously, that's not all they're leaving with, they're leaving with some knowledge as well. So I think it's, kind of what to the point that Brian brought up, and once again, is that, meeting people where they're at and making sure that, this is like something that's complex, and creating something that gives information in a way that's kind of palatable to the people as well. We are going to give them the truth and the hard facts and things like that, but at the same time, we still need to make it something where there is community building and it's not just like rainbow washing or something.
Yeah, I love your having the clothes swap and the dodgeball, and really making this very interesting too. I know a challenge for some coalitions that might be involved in overdose prevention or individual organizations, they may be unaware of which organizations are in their area. I think that's a great, as you were saying, Brian, a reason why something like Grindr is so effective, because it is accessible pretty much anywhere. But if there are organizations, I mean, you're in the Visalia, that kind of San Joaquin Valley of of California, but how can people find out or connect with LGBTQ organizations in their communities? Or activists? There may not be a whole organization.
I think it's, the best way is, word of mouth, right? So somebody comes in, they attend a program, they come to an event, they have a good time, they learn something. We provide community first, right? I think so. And the programming and education is secondary to that. So I think word of mouth is really important. I think we've been really lucky, with a very strong presence on social media. I think we also have a unique situation where we are we're the only LGBT center in town. We're not the only folks that serve LGBT folks. So we have lots of really good relationships with, folks who work in recovery, work with homeless folks or unhoused individuals. We have tried to be really good partners with our public health department, our mental health services, our behavioral services department. But I think people go to the internet, they Google it. And if you're not searchable or findable, you're doing your community a disservice. I would also want to say two things. I forgot to mention that the slides before were not created by me, nor was the program. That was run by one of our program managers, Noah Deeds. And then secondly, I think it's really important to engage queer and trans folks in this work. I think the reason why this work is so effective when we do it this way is because people trust us because we are who they are. Like, they trust us because they're already in relationship with us. I don't think these programs work in a medical model. I think they work in a community model. And so that's been really effective for us. And we hope to continue to do that work with folks.
Wonderful. We can certainly see by the responses from our attendees that really connected with folks. Engaging people with lived experience is just so critical to all of our overdose prevention activities. And I love the way you're giving very concrete ideas of how individuals and organizations throughout the country can identify and connect with LGBTQ plus community. One thing you mentioned is absolutely kind of the underpinnings, and that's trust. We know that with anything we do, that it's so basic. If an organization, this is relatively new area, or they've been wanting to do this but don't know where to start, how can they build trust with the LGBTQ plus community?
I think this is something that as a Latino Equality Alliance have been able to do relatively well, and that's because with the programming that we do, we have a lot of events, right? So who are we hiring for these events? We're hiring the local performers, the local queer talent. These are ways that we're able to, build that connection with community and the leaders of that community. Is by, putting our money where our mouth is and, really inviting them in to, do their thing and show their talents and share their experiences with us. And I think that's something that kind of gets overlooked a lot of times because, and that's also, it's layered, but I feel like, well, specifically for drag performers, there is a lot of, people that try to just take advantage of drag performers and their worth and their talents by just being like, oh, come volunteer for this thing and volunteer performance or something. But that's not really sustainable for the drag performers. And oftentimes the drag performers are community members that need services the most. A lot of these drag performers are doing they're performing as a means for survival. It's not just like something fun to do. And that's also the case for not just drag, but also different types of art and performance arts. So that's something that we've been able to do, and we found that it works, is, you know, making sure that the queer community in our area feel supported by us and feels like they could count on us for different gigs and things like that. But also, it's not just we're like some like money bank or anything. These same performers end up coming back and helping us out whenever we need anything, and they're the ones that refer their friends to come frequent our organization and come see what our services are all about. So I think it's, you know, to put a, you know, long story short, investing in our community.
Mhm. Thank you. Great ideas. And I just love how you keep coming back, both you keep coming back to this building or you know, creating community in all the work that you do. It's so important. We have several questions now from the audience. For Brian, your social media campaign is amazing. The question is, how do you engage with individuals who are unhoused or who may not have access to social media? Could you give us some ideas about this?
Sure. So it goes back to trust, right? So we have to partner with folks who are already doing that work, and we have to come alongside them to do that work as well. Because if we just show up and start passing out, you know, resources, there is going to be some lack of trust there, right? So that was where our relationship with Salt and Light came into play. I think it takes time too. So building trust takes, for us, especially in rural places where people have lived almost in the same place forever. They know, everybody knows everybody's family. Everybody knows, if you're new, there is a big distrust there. So it takes time. I used to live in LA, and people were transplants. They make fast friends. You have to, because you're in a city and you need connection. But in rural conservative places, there is a big mistrust and things just take more time. So I would say partnering with trusted messengers that also say, like, we know how to do unhoused outreach, but we don't know how to do it LGBT competently. And then going in and into those spaces, training their staff, having true partnerships so that when we go out in the field, they can say, oh, hey, there's this person, this is the source. They're sort of we gain trust by proxy. So that's been helpful.
Trust by proxy, that's an excellent idea. The word of mouth, that people trust you and they pass the word on. That's great. And we did have some specific questions about the challenges of, you know, the LGBTQ plus individuals face in rural communities, and any other suggestions you have regarding how to either of you, how to most effectively reach and support individuals in rural areas, particularly rural conservative areas.
I would say, just speaking, so the Southeast LA area is not rural, but you know, it's a little bit more disenfranchised than LA City proper. So I would say that, you know, this is kind of something that we kind of had to work around and find out as we were creating the program, because like I said, a lot of our programming were like these big fun events, right? But for the person or the student or the child that's closeted, that might not be the best option for them to come out and engage with us in that way. So I think for us, it was making sure that our programming and more so like our support groups and workshops were accessible, and they had like an online component. That way, if they did want to engage with us, you know, it's a little bit more discreet for them, where they don't have to ask their parents permission to like go out to go to this big event or something. They could, you know, log in from their phone in their room.
Great idea. Thank you very much. This is a question for both of you. Can you talk a little bit more about how you do your outreach? Where do you find your outreach worker, and how do you compensate them? I guess that would go for the ambassador program also, Bibi.
Yeah, so just a little bit about the ambassador program. So it's 5 ambassadors over the span of 6 months. So we had them sign a contract for like, you know, 6-month term. And I think they did about 8 hours a week. So that was like hybrid online and in person, because they would like physically come and work with us. And then also they would do like online outreach and also tune into like online meetings and things like that. So it's about 8 hours a week. And it was a stipend that they would get each month. So I'm not sure if I'm at liberty to say how much they got. just being real, but I will say that it was a good stipend, and it was something that they were able to like really utilize to, you know, supplement their income. It really helped. It wasn't like, okay, maybe I'll say this. Okay, so it wasn't like the type of stipend where it's like, which is good, you know, this is good, but it wasn't like a 20, you know, get $20 for attending our community advisory board meeting. It was a lot more than that. And it definitely helped them, I believe, in, you know, being just living their lives, honestly, because they were doing a lot of work and they deserve to get compensated for that. So I guess to that point, I would just say, don't be cheap when it comes to the work that we're doing, because these are the people that bring life into your programs.
Thank you so much.
Yeah. And I love that. Don't be cheap, because it's true. I mean, not only is the work carries emotional labor, right? And so folks who have lived experience are also going to be talking about like their trauma, their experience, all that stuff. That's going to be hard for folks. You know, this work was funded through a grant. The grant was for 1 year. A lot of the MAP funding is coming on a rolling cycle. So we're really careful to like just be strategic about what we're doing so that we're building on the thing we did last. We're not trying a lot of like new, you know, innovative things. They're innovative to our area because we have no resources. So, you know, when there's nothing exists and you put something in place, you know, something is, it's like, oh my gosh, there is something. So everybody that worked on the project was funded through the grant. It was overseen by a program manager, a program coordinator who were on staff who are also working on other projects, maybe 2 or 3 different grants that aren't substance use prevention or MAT. But we did contract with several other organizations. So we contracted with the Recovery Center in Fresno, who already had access to folks who were coming to group but didn't have an LGBT specific group. So we contracted with them. They already had touch points with people who were in, you know, an intensive outpatient program. And then because of the funding that we had, they were able to put together an LGBT affinity group there. And that was like, people there were so excited because nothing like that existed. And then we were able to contract with substance use prevention counselors who identify as queer to come into our spaces and talk openly about their experience, harm reduction that's outside the 12-step model, because there's so many 12-step meetings in our area, but there isn't a lot of other options. So that's where we spent most of the money, was on people power.
You know, along the lines of what you're saying, Brian, there's a question here about any thoughts on integrating LGBTQ plus Two-Spirit folks as peer support specialists in emergency departments and acute care hospitals if somebody's experiencing an overdose. And then how can navigators work more effectively with the LGBTQ plus community within the hospital setting? What should navigators know? That's for both of you, but I just, when you were mentioning, you know, the work that you're doing currently.
Yeah, so I mean, it just really comes from building those relationships with our allies within the hospital or within whatever organization it is or entity it is. And that it does take some work. But like an example that we actually had recently is that we were able to build a relationship with a resident at Adventist White Memorial here in Boyle Heights. And she invited us to do like a lunch talk with the doctors that she works with in her department. I'm not really sure the breakdown of the hospital system, but it was a room full of doctors, and we were able to talk with them and speak with them candidly about, you know, the issues that transgender people face when trying to access care. So that's kind of one of the steps to, you know, making the medical system and the medical care a little bit more queer competent, and especially more trans competent, because a lot of these people don't really know, or they don't really interact with trans people in their day-to-day life. and they're not really sure on how to do that, especially in a clinical setting, but they need to know how to do that because oftentimes trans people are very disenfranchised and very oppressed when it comes to medical care and accessing that. A lot of doctors won't ask simple things just because they're afraid of their client or their patient. So I think it just goes back to, creating connections with different organizations and finding who your allies are within those systems that may not be so welcoming or historically welcoming.
Yeah, something that strikes me as has been kind of a theme throughout this is the isolation, issues with lack of connection. And I like to quote that the opposite of addiction is connection. We know that there's a lot of stigma around addiction. There's a lot of stigma around harm reduction. And there's a lot of stigma around the LGBTQ plus community. How do you push back? How do you address that stigma or those layers of stigma that can be in place?
So we push back in different ways, right? So I think within systems that have, been really either oppressive or stigmatizing or outright, discriminatory against us, I think being at the table, and being in those systems, whether it's on an advisory board, whether it's in their, a 3-year CHIP process, being at the table when we're planning, doing needs assessments for our community is really important. I think that work is happening in our community, for the first time probably ever, where there's queer and trans folk represented. I think that, there's community stigma around being queer and trans, right? There's familial stigma, there's religious stigma, and all of that is intersectional, right? So, and then there's, the way that different communities respond to someone coming out, it's not a one size fits all answer. You kind of have to look at the intersections of folks, where did they grow up? How did they grow up? Is there familial support? Is there any support? Are they unhoused? Do they have a mental health issue? Are they employed? Are they in school? All of these things, being queer or trans is just a part of our identity. There's so much more to us. But I would say the biggest barrier for us is that the systems that we rely on to help us when we're in crisis don't understand how to help us because they don't have a lot of queer and trans folks in those fields, right? Working, not in our area. When we do meet a culturally competent provider, they're usually in the emergency room and they're not from here and they won't stay here. Or they're a resident and they're training and they're going to go back to they want to live in a city they want to live in a city and practice. They don't want to live in a rural conservative area. So for us, I think it's about visibility. It's about, creating relationships so that we can build trust with people who don't understand our communities, right? And then also build our own community so that when those systems don't work, that we have enough movement building and power that we can put pressure to say, this isn't working for us. We have to do it differently. And if you're not going to help us, then we will find funding to either provide free mental health services, free recovery services. You don't have to go through your insurance. You can just come here, right? You can talk to us. So it's been a little bit of you're doing a lot of things at once. You're trying to work within the system and outside of the system.
There's great points. We could go on talking about this very important topic all day. Unfortunately, we are at the end of our time, but I really want to thank you both so much, Ryan and Bibi, for the incredible work you're doing and for sharing that with our audience today. Thank you so much. And thank you to all of you, those of you who have joined us today. Could I have the next slide, please? We have a lot of responses there. They're sending in love. Wonderful. One more slide, please. So I want you to know that the slides from today's presentation, additional resources will be available on the National Overdose Prevention Network website. And there are additional resources that you can access there. And then next slide, please. We also want to let you know that there will be another webinar through the National Overdose Prevention Network. That'll be on the National 988 Crisis Lifeline. Just to know what's going on. This started some time ago, but to give everybody a sense of what that resource is and what it can do for you and your communities. So again, thank you so much to all of you for joining us today, and have a great rest of your day. Thank you and goodbye.